Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another important topic, DABT, that is xylene and ethyl benzene toxicity. So let's directly dive into the question. This question is taken from ABT recertification examination May 12, 2000 question paper. So the question is xylene toxicity is characterized by, we need to identify the characteristic feature of this particular solvent, organic solvent xylene, a relatively low acute systemic toxicity compared to other solvents. So you always need to compare xylene, benzene, toluene, like that, propanol, all these type of organic solvents are there, no? Second option is a high potential for chronic toxicity due to its effect on the bone marrow. Actually, bone marrow related toxicity, you will come across benzene. The characteristic feature of benzene toxicity is bone marrow. Okay. Option 3 is bronchopneumonia subsequent to inhalation of vapors. So most of these organic solvents, if you see, those industrial workers, whether you were working in pharmaceutical industry or those who preparing in the manufacturing industry, no, they're frequently subjected to this solvent exposure. So most of the characteristic feature of these solvents will be CNS related toxicity. Okay. Then inhalation of those vapors, because daily basis they are getting exposed in that factory GM manufacturing facility, no. So exposed to these type of solvents will lead to inhalation of these vapors will lead to bronchopneumonia, lung toxicity. So respiratory system is the target organ for this type of solvents. Option D is an odor threshold exceeding its threshold limit. So coming to occupational exposure, no, as you have occupational exposure limit, similarly like you have STEL ceiling limit will be there. So similarly for odor also you will have some limit will be there, ceiling limit will be there. So the threshold limit will be there. Before beyond that order, if a person is exposed, then he will have toxicological symptom adverse effects he will be having. So the such type of poisonous gases also for order limit will be there. If you look into MSDS section 8, no, in addition to occupational exposure limit, with respect to odor also you will be having, with respect to surface contact also you will be having some limits will be there. That you have to remember. Okay. So an odor threshold exceeding its threshold limit. Option E is all of the above. The right answer will be in the green text, that is option C. That is bronchopneumonia subsequent to inhalation of vapor. As I told you, no, whenever you are exposed to this type of organic solvents, industrial solvents, daily basis, 5-day exposure, 40 hours per week exposure. So respiratory system, CNS, these are the characteristic target organs for this type of solvents. So let's see what is the explanation which is given by the previous DABT students. Xylene and ethyl benzene. So whenever you are reading xylene, you have to also read ethyl benzene in in uh, in association with ethyl benzene. You have to read. Why? Because in Clayson textbook also, if you look into that solvents toxicology chapter is there, no, under that section both xylene and ethyl benzene are kept under a similar umbrella, similar paragraph. I will show you the important pages also. So xylene and ethyl benzene appear to have very limited capacity to adversely affect organs other than CNS. As you can see, the characteristic target organ is CNS. But what about the kidney, liver, or genotoxic cancer? These things are not caused by either ethyl benzene or xylenes. Okay, that you have to remember. That's why our option also like this you have to see. Mild transient liver. There are a few cases where they have reported that there is liver toxicity or kidney toxicity occasionally been reported in humans exposed to high vapor concentrations of xylene. Okay, this is the thing you have to remember from the exam point of view. And if you look into the ethyl benzene, this is a typical benzene structure, and you are having C2H5, that is CH2, CH3 will be attached here, whereas in the case of xylene, it exists in three isomer forms, that is ortho, meta, and para. If you look into this one, benzene with the CH3 is toluene. Okay, if the methyl group is on the ortho position, it is orthoxylene. If it is on the meta position, it is metaxylene. If it is in para position, it is paraxylene. These are the three things you have to remember. And xylene exists in the form of mixture in the nature. Okay, and not only that, if you look into some petroleum this thing or coal tar or some plant extracts, always they exist in mixture. It is very difficult to differentiate or them into fractionations. So the assessment, risk assessment also you have to do with respect to mixture. But one thing you can do is that in the mixture also, if one component is in higher concentration, you can focus your risk assessment toward that particular concentration, with a higher concentration of that particular mixture, which is responsible for causing adverse effects. Okay, so you can stop, pause here, and see what are the different target organs, how they are affecting. So let's move into the second slide. So this is the thing which I was saying, Clayson short textbook, chapter number 24, toxic effects of solvents and vapors, page number 368. See, two things are there. Clayson, you can read that 1500 1600 pages textbook. Okay, in that also chapter 24 solvent chapter will be there. Since we cannot discuss the entire textbook over here, I'm discussing short textbook. Okay, you can go back and refer same chapter. Under that paragraph will be there under subheading xylene as well as ethyl benzene. So let's see what are the important. See, at the end, what is important is we need to remember whatever we are reading. We have to remember so that we can execute, we can implement in the at the time of our exam. We will be able to choose the right answer. Okay, how much you read is important, but in the end, how much you remember at that point at the time of appearing for the exam is also very important. So xylene and ethyl benzene, directly we are reading about this textbook. Large number of people are exposed to xylene and ethyl benzene occupationally and environmentally. So there are two types of exposure. Occupational exposure, the factory workers manufacturing in the pharmaceutical industry, rubber industry, styrene, plastic industry. Okay, they are exposed. And environment, if that xylene is there in the in the nature, if when a volcanic eruption is there, earthquake is there, or some kind of mining is there, there also there is a environmental exposure either through air, water, soil, or occupational, the factories on a day-to-day basis workers are exposed to this particular type of two types of exposure are there. Xylene and ethyl benzene, like benzene and toluene, as I told you, know you cannot differentiate, you have to read integratedly. So xylene also we are discussing, ethyl benzene, benzene and toluene also. So similarly, like that of benzene and toluene, these two solvents are major components of gasoline and fuel oil. So if you look into the petroleum, gas oil, and natural oil, these things are the no at different fractionation, different temperature, different different based on your vapor pressure or density, these extracts will be formed. So at a particular pressure or temperature, when you heat this gasoline or fuel oil, you will be getting xylene and ethyl benzene. Okay, so there are major components of gasoline as well as fuel oil. So the what is the source, you have to remember here in this case. Okay, the primary uses of xylene are industrially they are used as solvents, and they are also used as a synthetic intermediates. So these are the applications of xylene. Okay, source over then application we have seen. Most of the aromatics released into the environment evaporate into the atmosphere. Why? Because of the vapor pressure or density. These are the reasons. Physicochemical characteristics also you have to remember. Okay. Fourth point is similar to toluene and xylene. Other aromatic solvents are well absorbed from the lung and GI tract. As I told you, know that is our answer. Option C was bronchopneumonia. And GI tract distributed to the tissues according to the tissue blood flow and lipophilicity. So these the solvents have higher lipophilicity, because of which it is able to cross the blood-brain barrier and it is causing CNS toxicity. Okay, exhale to some extent. So if you look into ethyl alcohol also, some of the things will be eliminated through your through your respiration, exhaled to some extent. Okay, well, so similarly this also well metabolized by hepatic CYP450, so they have not mentioned which particular CYP enzyme. Okay, and largely excreted urine metabolite. So amount of, even if it is absorbed or if it is getting metabolized through GI or everything, the excretion is through urinary metabolites. This is the important thing you have to remember. So what is happening when you are exposed to xylene or ethyl benzene on acute exposure? What are the outcomes on chronic exposure? We'll see. Acute exposure in the large concentration at a time. Lethality of the hydrocarbons. Hydrocarbons, you have to remember this also. Ethane, methane, all C and H. CH related whatever alkyl chains will be there, that one. That is CNS depression. Varies directly with lipophilicity. More the lipophilicity, more it is able to cross the blood-brain barrier and it is causing CNS toxicity. That you have to remember. There is a limited evidence that chronic exposure on repeated exposure for a long period of time, xylene is associated with residual neurological effects. It means today you're going, for example, I'm a person who's working in a certain factory where I'm exposed to ethyl benzene or xylene as a solvent on a day-to-day basis. 5 days I'm getting exposed Monday to Friday over a period of 6 7 months or 1 year. After that also, if I stopped working, still there will be residual neurological effects will be there, because of such a chronic period for such a long time I was exposed to this type of solvents. Okay, even if I quit my job, still there will be residual of this neurological effects. This is the statement it means. Next, xylene and ethyl benzene have limited capacity to adversely affect organs other than the CNS. This is very important. So one question they'll ask you with respect to target organ. What is the target organ? CNS. Liver, kidney, everything is very few reported cases are there, but major organ is CNS. Mild transient liver kidney toxicity. This is the same explanation which was given by our previous DABT students. Mild transient liver and kidney toxicity has been reported occasionally in humans exposed to high vapor concentrations of xylene. On high concentrations of xylene exposure, there is a possibility of you getting liver or kidney damage because urinary metabolites is there. So whatever it is there, metabolism has to take place in the liver, elimination has to take place in the kidney. So upon long term exposure, high concentration of exposure, there is a possibility of getting liver or kidney damage. So this is the thing again you have to remember. Next, majority of the alkyl benzene. Here alkyl benzene means immediately you have to imagine methyl benzene, ethyl benzene, propyl benzene. So alkyl, ethane, methane, CH3, C2H5, CCX6, anything it can be there, C5H7 like that. Okay, propyl benzene do not appear to be genotoxic or carcinogenic. Okay, these are the things. Probably he's saying that, but ethyl benzene and styrene are known animal carcinogen, but there is limited human data. So this is how you have to read it. Okay, whether this particular chemical is genotoxic. In general, alkyl benzenes are they are not causing DNA damage, they are not causing cancer. But ethyl benzene is an exception, reported to cause cancers in the case of animal, but the association in human there is no association. So there are no reported cases of this particular ethyl benzene is causing any cancer in humans. Okay, so this is a thing I kept it for you people to compare. This is a typical benzene structure. Okay, and this is orthoxylene. Toluene, if you look into toluene, no, benzene with a methyl group. This is a simple benzene structure. When a methyl group is attached, it becomes toluene. If another methyl group is attached on the ortho position, it is orthoxylene. If it is attached on a meta position, it is metaxylene. If it is attached on the para position, it is paraxylene. And here, in the case of toluene, if you see, CH3 instead of CH3, if we have C2H5 or CH2CH3 or ethyl group, it is called ethyl benzene. So this is how it is. All belongs to the same class of benzene derivatives, you can say. Okay. So let's see. In addition to that, till now we have read about in class and textbook under chapter solvents. We have read what are the characteristic features of xylene as well as ethyl benzene. Now we'll shift towards little bit learn about risk assessment. Okay. So what we are going to learn here is ISH Q3C guideline, that is impurities for residual solvents, their qualifications. Okay, so this is there a part of a DABT syllabus. Okay, ICH Q3C guideline is there. Q3A, B, C, D, E. Total 5 Q related guidelines are there in the exam. So C we are discussing, which is respect to solvents, and it is revision 9. So till now 9 revisions have taken place, and the document is 24th January 2024, the latest. Today we are in 2026. Okay, so whenever you are reading, this is the first page of the guideline. In the second and third page they have given what are the changes which took place over this 9 revisions. That also you have to read whenever you are reading any guideline, whether it is EMA guideline or ICH guidelines. You have to always see what are the changes, subsequent changes, supersede the previous versions. Whatever the changes are there, that you have to remember, because examiner will ask those latest questions also. Okay, so we'll discuss about xylene. As I told, xylene exists in the form of mixture. So we have three different mixtures, that is meta, para and ortho. In addition, it is also having ethyl benzene, so it is existing as a mixture. Okay, so 60% the major fraction is metaxylene, 14% is paraxylene, 9% is orthoxylene, and 17% is ethyl benzene. This is how it is existing. So most of the literature, most of the toxicology studies, when you do, you are giving the test item which is consist of all these components to the animals. So what the main purpose of this Q3C guideline is, they will be calculating permitted daily exposure. If this solvent is used in the production of a certain pharmaceutical or certain chemical or certain plastic material, the or certain type of production is there, in the final product this solvent should not be there. So even if it is there, some residues, if it is there, if it becomes very challenging to remove it completely, so the guideline allows, ICH allows that some amount can still be retained in the final product. So what is the limit that will be decided based on permitted daily exposure, which will be there in your uh, certificate of analysis or specification document. So in case of xylene also, in the guideline, this is a classic example is there. So it comes under class 2 solvent. Okay, class 2, what are the thing? It has a common name is dimethyl benzene, because two methyl groups are there at different positions, and another common name is xylol. Okay, so first study with respect to genotoxicity, they have seen, it is said that it is stated that consistently negative in vitro studies and in micronucleus test in mice. Okay, so we have seen in the previous explanation also, previous second slide it was there. It is not genotoxic. So xylene is negative in vitro studies and micronucleus test. Second one is cancer studies. So under cancer studies, we have NTP study. NTP is National Toxicology Program under US. So they will be conducting for commonly available hazardous chemical. No, they will be conducting some toxicology studies, 2 year studies, which include dose range finding studies, 13-week studies, as well as a 2 year cancer study. They wanted to identify whether a certain chemical is having a threat or potential to cause any cancer or not. So they will be doing 2 year mice study, 2 year rat study. So from this only this particular study was taken. For xylene also, NTP has done some 2 year rat study and 2 year mice study. So first study is cancer study. So they have taken it from NTP. The study took place in 1986. So this is the table you can see. You can pause the video and see. So the doses are here taken from here only 250 and 500. So at 250 and 500, by gavage corn oil. So corn oil is the vehicle here. Rats are exposed 5 days per week for 2 years. So this is a typical 2 year study. And here it is a 5 day week. So we have to correct it to continuous exposure. So in a week, how many days are there? 7 days are there. So you have to correct it by extrapolating to 7 days exposure, continuous exposure. So 5 by 7 you have to do whatever this 500 value is there. What is 500 actually? Evidence of carcinogenicity. Reference is so and so. So here in this case, the NOEL is 500. Okay, so they have, for continuous exposure, they have multiplied it 5 by 7. The answer is 357 mg per kg per day. This is the value. So when you are applying permitted daily exposure, 357 into 50 divided by 5 into 10 into 1 into 1, because they didn't find any tumors in this study. So F5 factor will be 1, F4 will be also 1, and F3, since it is a 2 year study, it is 1. F5 is 5, F1, F5 is for rat, and F2, 10 is for intraspecies variation. Okay. Similarly, same NTP study, another that is species, that mice. Mice they have taken and they didn't find tumors at 1000 mg per kg. So similar type of calculation, they ended up with value 360 mg per day as the permitted daily exposure. Now let's see what is the another if study with respect to xylene only, that is reproductive toxicity. In this case, what they have taken is they have taken mice study and the doses are 0.6 to 4.8 ml per kg gavage, and here the vehicle was taken as cottonseed oil, and the treatment duration is gestation day 6 to 15. We are considering mice. Okay, here at 4.8 means highest dose there was lethality. Maternal toxicity at 3.6, 3 ml increased resorption, 2.4 ml fetal weight decreased, cleft palate at cleft palate, open eyes, and exencephaly. All three things were observed at 1.2. So lowest dose, that is 0.6, at which they didn't find any adverse effect. This 0.6 is no effect level in this particular study. So they are considering this 0.6 and deriving the permitted daily exposure. But again, you have to remember the units here is in ml per kg. So you have to convert this to mg per kg, because the final units of permitted daily exposure will be mg per kg. So how we are doing? You are multiplying it with the density. Here 0.86, if you look into xylene, no, the density is 0.86 to 0.88. Okay, the specific gravity or density, whatever you say. So once you multiply this 6.6 ml per kg into 0.86, this is your density, you will get the your NEL, that is no effect level, in the mg per kg unit, that is 520 mg per kg. So 520 you are multiplying it 50. 50 is the average body weight for calculating this type of permitted daily exposure limits. Okay, average body weight, not 60 kg, not 70 kg. 12 for mice. Okay, and 10 for intraspecies variation. 1 is for treatment duration. Okay, because entire organogenesis period is covered. 10 Why 10? Because you have seen cleft palate, open eyes, exencephaly. So whatever the risk assessor here in this case, no, he is considering all these things as teratogenic. And he is considering this teratogenicity without maternal toxicity. Why? Because all these effects are taking place at 1.2 ml per kg, but the mother, the maternal toxicity, they have observed at 3.6. So if a mother is exposed to 3.6, and if you are assuming that mother exposed at 3.6 is safe, so by default, children will also be at safe 3.6? No, because at 1.2, you have seen fetal adverse effects are there. Teratogenicity is there. So whatever these things are there, no, these are without maternal toxicity. For this reason, they have considered higher factor, that is 10. 10 for teratogenic effect without maternal toxicity. This 10, you understood, hope you understood. So you can pause here, go back to the guideline, try to understand the F4 factor. When F4 factor is for those type of severe toxicity, mostly which is irreversible type of damage. So you have here non-genotoxic carcinogenicity. In the carcinogenicity also you have genotoxic and non-genotoxic chemicals which are directly attaching the DNA, chemical which are hindering the various processes in the form of in the process of form of cancer. And you have neurotoxicity, CNS toxicity, which is again a irreversible type of toxicity. Conversions, all this still comes under, you have to consider F410. Teratogenicity without maternal, that's why you're considering it here 10. And also cancer also you have to consider tumor, okay, 10. So that was the explanation. So in addition to that, they have considered another study, um, another NTP study, where they have considered 13-week study, and NEL was 500. So similarly here, if you can see, they have considered 5. Why? Because it is a 13-week study. Here you can see why 5 for 3-month study. So 13-week or 3-month is same. So whenever there is in rodents, if the study duration is 3 month or 13-week, you have to consider F3 5. Okay. For 2-year non-rodent study, you have to consider for a 2-year study, that is dog, rabbit or monkey, then also you have to consider the same factor. So again, pause here, try to read about this particular, and something, any duration which is coming in between, for example, it is coming in between 6 and 9 months, then you have to go for higher factor 2. Okay. So like that, that was about ICH-Q3C. You can go back and read about this class 2 solvent xylene. So in addition to that, we will discuss, some people might also be reading about toxicology of board questions. 2000, there is a separate book, book is there. So in that, about xylene, they have asked the question. Xylene is present in gasoline, primarily CNS toxic, not genotoxic. So if you read the textbook properly, Clay said no, all 3 points are there, all of the above, because the what is the source we know, primary target organ we know, and it is not genotoxic. So once you read the textbook, you will be able to answer the question. Okay. Second one is percutaneous absorption of xylene and toluene vapors in humans. So this again you have to remember with respect to lipophilicity, whether it is able to cross the skin barrier. So it is usually insignificant. It is not able to cross this skin absorption. Okay. Next, one more question we have taken it from AACT, that is American Academy of Clinical Toxicology, question of the day. So since this particular question paper is set by American, so I am trying to pull some questions from AACT also. So in that they have given what are the so-called BTEX compounds? What comes, what type of solvents comes under BTEX compounds? You need to remember. The answer is BTEX. It is an abbreviation that stands for volatile organic compounds. So benzene, toluene, ethyl benzene and xylene. So all these four, again you read what are the benzene ke liye bone marrow depression, you read toluene, you read ethyl benzene, you read xylene, so that any question with respect to these type of solvents will come in exam, you will be able to answer. These are already listed under your solvent chapter in the Clayson. Okay, solvents and vapors toxicology, solvent toxicology, very important, because industry, they need solvents to dissolve it. So one in particularly factory workers will get exposed. So 1 or 2 questions you will be getting. For example, I'll tell you, those who people are living in Andhra Pradesh or Telangana in India, 1 2 years back there was a styrene leakage was there. Okay, some questions on styrene. So there are people coming out of the factory where people under they had serious CNS conversions, respiratory issues were there. Why? Because there is styrene leakage was there. Again, styrene will comes under solvents only. So like that, latest things they will be asking. Okay. Um, anyways, that was the thing about thank you so much. Be curious. For any questions you can always write mail to arya.priyanka18@gmail.com. One last thing I would like to say that read OECD guidelines if you are preparing for the exam, and ICH guidelines also. I am trying to cover from the previous question papers, but I will soon start giving some questions from ICH guidelines also. All ICH safety guidelines, all ICH Q guidelines, as well as OECD guidelines, and something which related to alternative methods are there. Like for example, 483 383 for phototoxicity testing, alternative method ICCVAM, such kind of testing are there, no? And I came to know that last year a lot of questions came on read across also. A lot of chemicals on alternative methods like use of software or read across surrogate molecules. Such kind of questions are also being part of, which are a part of risk assessment. Okay, so mixture assessment like this we have seen now. Similarly, like that, if there is literature is not available on a certain chemical, you can consider a similar class of chemical, and you can mitigate the risk. So like that, they'll be asking you questions. Okay, all the best for your exam. Thank you so much.